So what are the factors that affects the collection of the cord blood after delivery of the baby? So after the delivery of the baby, the umbilical cord, which contains the stem cells, which will be collected immediately after the delivery. So what are the factors that affects the quality of collection? For example, there are factors not in our hand, which is called biological factors. For example, if the baby was very small, that means only 1.5 kg, 1.7 kg, that means the placenta size is small, so it will not give you enough blood. Then the blood volume is low, not because the nurse, she didn't know how to collect it, or the gynecologist doctor did not know how to collect it, because the baby size was small, therefore the placenta size is small, so this is the maximum blood available. However, let's imagine the other scenario. If the baby was 3.5 kg or 3 kg and above, usually the placenta is in the standard size, then it has more blood, then it will be much more easy to have a greater volume and a bigger volume when collecting the cord blood. Therefore, there are factors that is important to focus when it comes to human. So the factors that comes to human that we can control is knowing the procedure of the collection. For example, after the baby comes out, that umbilical cord needs to be sanitized very nicely to make sure it's clean before I collect, because this can affect the collection. Because if it is not sanitized nicely and cleaned nicely, the umbilical cord, contamination can happen. Then this is something related to non-biological. It's a human error. So we have to sanitize it very nicely, then put the needle of the inside the collection kit. There is a needle. This needle goes to the vein. By gravity, all the blood will go into the collection kit. Then this is the nurse or the doctor need to make sure that she drain all the blood that is in the umbilical cord and make sure that every drop is inside the collection bag. After that, she needs to label it very well, because if she did not label it, and if it is reached to the lab not labeled, then it will be an issue. We have to reject the unit because there is no patient name. And we cannot call the hospital and ask them, who is this patient? Because there are hundreds of deliveries happening in the hospital. Therefore, labeling the unit at the right time after delivery is very important before sending it to the lab. So these three factors, as we discussed, are very important to assure that the collection happens in the right procedure and we are able to save the unit.